Hi, this is Josh, DreamBody Clinic. In this video, you're going to see me and the DreamBody team with Dr. Dezawa. She's the person that discovered MUSE cells back in 2010. In this part, you're going to see she's explaining the best delivery method for MUSE cells. So unlike mesenchymal stem cells, where we found targeted treatments seem to be best, her studies have shown that actually the IV is really the best administration for just about everything that MUSE cells help. So she explains here in like the Alzheimer models, as well as stroke recovery models, with the best administration is an IV because they don't get stuck in the lungs like mesenchymal stem cells, and they can cross the blood-brain barrier. So there's no resistance there and they can get there. With the mesenchymal stem cells, we found intrathecal is best. That's where we go into the spinal cord fluid. And she explains in this video how that's actually not the best route. They've tried that. They've tried intranasal injections and consistently found that the IV is the best route to the brain. We've done a few experiments with joints so far, same thing, we're finding the IV is the best. So the cool part with MUSE cells, it seems like a simple IV is the best route for all the various treatments, even for organs. Going direct, not as effective as just a straight, simple IV. So stay tuned, watch Dr. Dezawa explain in her own words, and you can check us out at www.dbcmusecells.com.
So the number two is that if the tissue is damaged, sphingosine monophosphate, this is universal damage signal. It's common to liver, kidney, brain, or whatever. It is produced from cell membrane. So any kind of tissue is made of the cells. So the S1P, sphingosine monophosphate, is converted from sphingosine to sphingosine monophosphate after breakdown of the membrane by damage or apoptosis or whatever. So S1P is common to any of the tissue when there are damage. The MUSE cell sharply sense S1P. So the most efficient way of administration route will be IV, intravenous drip, rather than local injection. I never confirmed up to now that the local injection or intrathecal worked well rather than better than IV. So IV is best.
But it's not proven, or it's not like?
It's proved in the clinical trial. It's also proved in many preclinical papers as well. But now just recently, we have very excited data, which is not published yet. But in Alzheimer's disease or the stroke is already published, but Alzheimer's disease or dementia, or maybe like an inflammation in the brain, intranasal, this will be almost equal to IV. Because, intranasal will be repeatedly done by nasal spray. Yeah. So the patient can receive the nasal spray to reach the MUSE cell. They will trap in the brain first. If you IV, first trap will be the lung. But if you do the nasal,
we can avoid that.
Yeah. You can directly deliver MUSE cells in very high efficiency.
The intranasal, do you recommend like the spray, or we can do like the intranasal injection like in the mucus or nebulizer?
I think the latter will be the better rather than sprays. Spray, I think we have to more investigate deeply, but up to now, intranasal drop.